Before we begin our training, it is important to understand a difference of great relevance between conventional and laparoscopic sutures. If the surgeon needs to make a stitch through the 2 points, he must necessarily perform a movement changing the angle between his hand and the forearm. If this wrist movement is not performed, simple rotation of the forearm would lead to an inadequate exit point as demonstrated. Since the laparoscopic instruments do not allow this angulation between the wrist and the forearm, it is necessary to position the needle at a wider angle, around 130 degrees, associated with a slight external rotation of the needle, so that a better accuracy is obtained only with the rotation of the forearm. The anatomy of the knot. The first step is the formation of an arch, positioning the thread and the needle laterally. 1. Entry into the tissue. 2. Exit from the tissue. And 3. Location of grasping the thread by the needle holder. The rotational movement of the needle holder will cause the thread to form an arc over the Maryland forceps. We must always pull the knot through the Maryland forceps, preventing the thread from getting stuck into its joint. Horizontal running suture. The purpose of this exercise is to simulate the closure of a horizontal gap, such as a gastroenteroanastomosis performed by a bariatric bypass with a surgeon located between the patient's legs. At the end of this suture line, it must be tied to previous left side repair stitch.